So my name is Rebecca Ray. I work at the University of New Mexico in the College of Population Health in Albuquerque, New Mexico, which is in the United States. Involvement in community health is working with communities and helping in their level of defining what community health means for them. And so in partnership with communities, we help to uplift what community health means, driven from the community perspective. So I work with, I guess, I'm Hickory Apache, so I represent a tribal nation in northern New Mexico. And in New Mexico, we have 19 Pueblo nations, Navajo Nation, 2 Apache tribes. And so a lot of the work that I do, 3 Apache tribes, I should correct that. And a lot of the work that I work with a lot of tribal nations here in New Mexico. And so in working with community health, it is really defined from a holistic perspective. And so when we talk about health, we're talking about it from a spiritual level, the mental level, and emotional, and then intellectual. So it isn't just about the physical health. It's really looking at our whole community as a whole and how we're defining health in all of those aspects. Our communities connected to our culture spiritually? Are we connected to our ways of knowing? Are those knowledges being passed on in a way that is helping to uplift our communities in a way that is grounded in our cultural ways that have been in place for millennial? And so, and the work that we do, it's really centered from a holistic way of thinking about health. In New Mexico, there's a lot of different, in our tribal communities, there are definitely a lot of community health workers. We have prevention specialists, we have behavioral health workers. And so in the work that we do, we work with folks at all these levels, folks who are on the ground, who are doing community-driven work. And so also community activists, and so community organizers. And so I think health comes from all of those perspectives in the work that we do. And so me, as my role as a researcher and evaluator at the University of New Mexico and working with communities, we work with folks that are working in these multi layers of community work. And so we're connecting with folks who are working in, working with the youth at the recreation centers. We're working with prevention specialists. We're working with teachers and administrators at the school systems. And so really trying to combine our folks who are working at all various levels in the community. And so I think it's not just necessarily one title when we talk about community health, because all of them are really uplifting the work in their community from their expertise. And all of those different expertise are really important when we think about community health. And so there really isn't just one title when we're thinking about community health. So, but there definitely are community health workers in our community, and they do a lot of amazing work with that title as well. I'm really thankful for this work because I started off as a grad student, and so I think really coming into my professional development was really driven by community work. And so I'm really thankful that a lot of the work that I started off in as I moved into my position at the university was I was doing a lot of community-based participatory research work. And so we were working with communities, and communities that we worked with, our tribal nations that we worked with in developing prevention programs, or developing leadership programs and youth programs, really were the driving force in my development of learning, and also just the advocacy of reminding that connected back to community, that while we may go out and get our academic achievements and our degrees, that really when we're working back in community, that we have to take a step back and realize that there's a lot of knowledge keepers as well in our community, and that you don't necessarily need to have a degree to be able to contribute knowledge and contribute the know-how to make our communities well. And so really it's one of the biggest learnings for me and the work that I do, and always reminding, is that we have the expertise in our communities, that we have the resources in our communities. And so it's just really being able to create the opportunities to bring people together, to be able to work together, and really driven from perspectives that are meaningful from the community. Like, what is meaningful from the community, and what is it that they want to be able to drive the work that is going to impact their community. And so that it is not from a researcher coming from an outside perspective into the community saying that this is what we see as a way to make your community better. It's really going into the community and asking the community, what are your needs? You know, what do you see are important for uplifting? What do you see are the challenges, and how can we work together to be able to help address those challenges? But more importantly, how do we sustain all of the beauty and all of the richness that is in community? And I think that has always been like that's been a big learning for me. And that is definitely something that drives me in the work that I do. And I'm really thankful for all of my community partners and helping to shape me and the work that I do. So I think facilitators is that, you know, when we really develop strong partnerships and we develop commitment to our communities that we work with, then that it really creates these long-term partnerships where communities want to continue to work with you. And so then it creates a longevity of partnerships that really helps to sustain the work that's happening in the communities. You know, oftentimes, you know, in the United States, a lot of our projects are grant driven, are, you know, it was really driven by funding. And so we're in partnerships with the communities that we work with, being able to continue to work in creating opportunities that bring resources into the community is important, but that doesn't happen without those long-term partnerships, right? And so being able to, I think that's a huge facilitator in the work that we do, is that our communities realize that, you know, we're committed to the work that we do, not just by saying it, but by showing up, by being present, you know, coming out, building relationships. I think building relationships is foundational and a huge facilitator in the work that we do. Our partnerships have ranged from almost 20 years, you know, and so being able to work with similar folks for that long, you start to develop family partnerships. So you become in some way welcomed into the community, and that's really a blessing. And for me, working with tribal communities is really important because I represent one of my tribal communities as well. And so just being able to have that connection with other communities, as tribal communities in New Mexico, is really important. And I think that's a huge facilitator. So having representation of someone at the university, you know, as a tribal person, representing a tribal nation at the university is really important as part of that representation and working out with communities, because there's a lot of similarities and understanding and connection, but also, you know, a level of respect. And so while we may have a lot of similarities in our cultural ways of knowing, there's also an understanding that I'm not from the community, and so that I also have to respect that community's ways of doing things and understanding, and so being at a place of learning. Oftentimes, I think a lot of our communities are in really rural areas in New Mexico. And so being able to get resources to some of our rural populations can be a challenge. Definitely being able to provide, getting services, or being able to travel to these small communities oftentimes can put a lot of strain. But again, it goes back to that commitment to our communities, and the work that we do, and being able to work through those challenges. But oftentimes I see in our communities, in our rural communities, that the ruralness can be a barrier in and itself, because of, even in the communities that are running programs, being able to get families to come together when people are living 20 miles away from each other. And so while they may be in the same community, they may be spread out geographically in this area. And so being able to bring people together to run for support of a community health program or a prevention program, a family program, oftentimes can be a barrier, because some folks may not have transportation as well too. And so being able to accommodate for transportation to bring for individuals who may live a little bit further out distance from the main part of town. So being able to bring them in, and so being able to work through those different types of challenges. But I think oftentimes in our smaller rural communities, can be a big barrier. I would say that have passion and really enjoy the work that you do, but also to really look to folks who've been doing this work. Definitely look to the elders in the community, look to the um, folks who've been in this doing community health work for as long as they've been doing. Mentorship is super important, and learning from folks who have been working along to really shift the community health. And so I think mentorship is really important. And so look for those mentors to be able to help support the work that you do, but also to just have the drive to continue to do the work, I think is really important. And that I think that the wisdom's always within ourselves, and the wisdom and the ways of healing are within our communities. And so to really build those strong partnerships beyond, and so to not just look at health from one department or from one field, but really looking at health from all of the different aspects of work that's happening in our communities. And so that partnerships are really important and part of the work that we do, because when we think about healthy communities, it really encompasses our whole community. And so really thinking about ways to bring various partnerships together in the work that we do.